Dorothy Johnson, Behavioral System Models.
Good day, everyone. Today, we embark on a journey through the world of nursing theory, exploring the pioneering work of Dorothy A. Johnson and the behavioral system model. This model revolutionized our understanding of how individuals respond to health and illness and has profoundly impacted nursing practice.
Dorothy Johnsons. She was born on August 21, 1919 in Savannah, Georgia. She was the youngest of 7 siblings. She graduated at age of 17 in senior high school in Savannah. In 1938, Dorothy got her Associate of Art from Armstrong Junior College in Savannah, Georgia. On June 8, 1942, she received her Bachelor of Science in Nursing from Vanderbilt University in Tennessee. Finally, in 1948, she received her Master of Public Health from Harvard University. From 1943 until 1944, she worked as an instructor of nursing at Vanderbilt University. She also worked briefly as a staff nurse at the Chatham-Savannah Health Council. From 1949 until 1978, she served as Assistant Associate and Professor of Pediatric Nursing at the University of California at Los Angeles. But she had an early retirement following an open-heart surgery. She left California to live in Key Largo, Florida. Dorothy Johnson is well known for her behavioral system model, which was first proposed in 1968. Her model influenced by Florence Nightingale books, Notes of Nursing. Dorothy Johnson's meta-paradigm. First, human, as having 2 major systems, the biological system and the behavioral system. It is role of the medicine to focus on biological system, whereas nursing's focus is the behavioral system. Second, environment. According to Johnson's, an individual's behavior is influenced by the events in the environment. Health is the purposeful adapted response physically, mentally, emotionally, and socially to internal and external stimuli in order to maintain stability and comfort. Nursing has a primary goal that is to foster equilibrium within the individual. Nursing is concerned with the organized and integrated whole, but the major focus is in the maintaining a balance in the behavior system when illness occurs in individuals.
Nursing Theory Overview. Nursing theories are the compass of our profession. They guide us in providing the best possible patient care. Johnson's theory is no exception. It offers a structured framework for understanding and addressing the behavioral aspect of health and illness. In essence, nursing theories like Dorothy A. Johnson's theory are not just academic concepts. They are practical nurses tools used every day in hospitals, clinics, and other healthcare settings. They empower nurses to deliver holistic patient-centered care, enhancing patient outcomes and overall satisfaction. So, as we explore Dorothy E. Johnson's behavioral system model, remember that we're not just delving into a theoretical framework but uncovering a treasure trove of insight that guide and elevate the practice of nursing. Dorothy remind us that nursing is not just about tasks and procedures, but about understanding, caring, and making a real difference in the lives of those we serve.
Good day po, Ma'am Heidi Pineda. I am Rhea Jane Yago, Bachelor of Science in Nursing, Block H, GROUP-5. So, now I here to discuss about Dorothy E. Johnson's. So, Dorothy E. Johnson's, she held various nursing roles including teaching and research. For instance, she observed how patients with chronic illnesses often feel a sense of dependency on healthcare provider, their family, or medical equipment which influence their behavior. Thank you.
Behavioral System Model. Now, let's explore the core of Johnson work, the Behavioral System Model. This model divides human behavior into four distinct subsystems. These are affiliative, dependency, ingestive, and eliminative. These subsystems cover a wide range of behaviors, from seeking and emotional support to fulfilling basic physiological needs.
Now, let's explore the core of Johnson's work, the behavioral system model, with a few illustrative examples. Dorothy A. Johnson's behavioral system model identifies four complete behavioral subsystems. Number 1, attachment affiliative subsystem. This subsystem encompasses behaviors related to forming and maintaining emotional bonds and relationship with others. It includes seeking companionship, emotional support, and social interaction. Examples include a patient seeking comfort from family members during illness or a child bonding with their parents. Number 2, dependency subsystem. The dependency subsystem involves behaviors associated with obtaining assistance, help, or support from others. Individuals may rely on healthcare professionals, family members, or medical equipment to meet their psychological or emotional needs. For example, a patient in a hospital may depend on nurses for medication, administration, or assistance with daily activities. Number 3, ingestive subsystem. This subsystem pertains to behaviors related to nourishment and fluid intake. It encompasses activities like eating, drinking, and maintaining a balanced diet to meet nutritional needs. An example is a patient with diabetes carefully managing their food intake and monitoring their blood sugar levels. Number 4, eliminative subsystem. The eliminative subsystem involves behaviors related to the elimination of waste and maintaining gastrointestinal health. It includes activities such as urination and bowel movements. For instance, a patient recovering from surgery may experience changes in bowel habits that require nursing interventions to restore normal elimination patterns. These complete behavioral subsystems represent various aspects of an individual's behavior and are central to understanding how individuals respond to health and illness within Johnson's model. Nurses use this framework to assess, intervene, and support patients in adapting their behaviors to maintain equilibrium in the face of health challenges.
To truly grasp Johnson's model, we need to understand key concepts like equilibrium, stimulus, adaptation, and nursing intervention. Equilibrium refers to a person's balanced state of behavior when a stimulus such as an illness or stressor disrupts this equilibrium. Adaptation is necessary to restore balance. Nurses play a vital role in this process by providing appropriate interventions. And for clarification, if a patient is diagnosed with a chronic illness, the diagnosis serves as the stimulus. The patient's behavior may change as they adapt to managing their condition. Nurses can provide education and support to help the patients adapt positively.
Application in nursing of Johnson's models. So, how does Johnson's models come into play in real-life nursing scenario? Picture a patient with a history of alcoholic abuse who is admitted to the hospital with liver problems. Nurses using the behavior system models can assess the patient behavior responses to illness and addiction, tailor intervention to promote healthier behavior, and support the patient on their journey to recovery.
Critiques and limitations. No theory is without its criticism and limitations. Some argue that Johnson's model may oversimplify complex human behavior. However, it's essential to note that nursing theories, including Jensen's, continue to evolve as our understanding of healthcare advances.
In conclusion, we've embarked on a comprehensive exploration of Dorothy E. Johnson's life and her impactful behavioral system model. This model provides nurses with a structured approach to understanding and addressing behavioral changes in patients due to health and illnesses.